Hi, welcome to Socialpost Health Channel viewers. I am Dr.Chava Anjaneyulu, Chairman for Asian ENT Care Center and Chief ENT Surgeon. Asian ENT Care Center is having laser treatment, coablator treatment, microdebrider treatment for sinusitis, and a cochleovestibular lab for diagnosis of hearing problems, vertigo and tinnitus. We are treating the tinnitus with injection platelet rich plasma into the ear, which is giving benefit to some patients. We are treating snoring problems. Snoring is very important disease. Sometimes it may cause life threatening dangerous conditions. Don't neglect snoring, get treatment. Nosebleeds are common in children and old people also. In children, mainly due to prominent blood vessels in the nasal septum, whenever they pick the nose or they go into dry weather, they jump more, or if any small injury to the nose also cause the nosebleeds. Most of the times these nosebleeds will subside and very rarely comes, no need to worry, but still need examination. If the nosebleed is coming very frequently, always better to get examination with the nasal endoscopy. Many times there may be small bleeds in the cartilaginous portion of the septum, which we can cauterize chemically and we can treat this very nicely. Most of the times we do chemical cauterization and we advise the patients not to pick the nose. Many children will become normal. Rarely persistent bleed with more blood vessel size, he may need cauterization. Sometimes telangiectatic vessels will be there, that also need cauterization. In elder people, mainly hypertensive bleeds are very common. And nowadays, many elder people taking aspirin or blood thinners to reduce the clotting in the heart and brain. Those who use blood thinners and if they go to dry hot weather, there is a more chance of the bleed in the nose. In dry hot weather, mucosa will become dry, underlying blood vessels will open up, and they are taking already blood thinners that will not stop the bleeding. So hypertensive bleeds mainly nasal septal bleeds. Usually once we control the bleeding, we take out the blood thinner and cauterize that bleeding point, patients will become normal. Rarely sphenopalatine artery bleeds, those are very important to diagnose and cauterize. These patients sometimes may need external carotid artery ligation also. But especially in younger males, that means around teenager boys, always we have to rule out a angiofibroma. Nasopharyngeal angiofibroma is the one of the reason for bleeding in these children, boys. Elder people, we have to rule out always malignancy. Nasal endoscopy examination is must for all nose bleeds. If you have any problem of nasal bleed, recurrent, continuous, contact Asian ENT Care Center located in Panjagutta, Hyderabad. For further updates, subscribe Socialpost Health Channel TV.